Good afternoon, everybody. Welcome to the first session in the Academic Senate Committee on Sustainability series on climate change. My name is Katherine Brooks. I'm Assistant Professor of Medicine in the Department of Hospital Medicine at San Francisco General Hospital and a member of the Academic Senate Committee on Sustainability. And along with Andrea Olmos, Assistant Professor of Medicine and Department of Anesthesia, we'll be organizing and facilitating this discussion today. So the purpose of this series is to engage health professionals in issues surrounding health and climate change and to highlight some of the really important and wonderful work being done around the climate crisis and its impact on health throughout UCSF. We also aim to identify ways that health professionals can get involved in advocacy and lend their powerful voice to creating solutions. As you all have experienced in your own ways, the effects of climate crisis are becoming more and more palpable every day. And as health professionals, we'll continue to, with increasing frequency, to see its impact on the health of our patients. And one often underemphasized impact is how it will affect mental health of our patients, our communities, and even of ourselves. So today we have two very accomplished speakers to share their expertise on this issue. So I want to introduce Lisa Fortuna and Robin Cooper. Dr. Fortuna is the Chief of Psychiatry at Zuckerberg San Francisco General. She's an investigator on several NIH-funded studies of Latinx and immigrant mental health and has an interest in implementation research and quality improvement projects to address inequalities in mental health. She's also written and talked about the impact on the climate crisis and mental health, particularly among children, with an emphasis on the inequitable distribution of this impact. Dr. Cooper is Associate Clinical Professor in the Department of Psychiatry and is co-founder of the Climate Psychiatry Alliance. The Climate Psychiatry Alliance is a national organization of psychiatrists whose mission is to educate the profession and public about the profound impacts of climate change on mental health, provide resources and information to professionals, the public, and the media, and to influence policy through advocacy. She's also a member of Physicians for Social Responsibility, an advocacy organization intending to give medical voice to climate solutions. So without further ado, I want to pass it over to Dr. Cooper to get us started. We'll hear from our speakers for about 40 to 50 minutes, and then we'll hopefully have some opportunities for you all to ask questions. Thank you all for being here.
I just want to check that you are able to see the screen. Is that correct?
Looks good to me, Dr.
Good, good. Thank you very much for that introduction. And I'm going to move along and start. I think I'm going to move along. I'm going to move along and tell you about a case today. This is a patient who shows up in the emergency room, an elderly woman. She's 4.5 billion years old, and she goes by the name of Gaia, or Mother Earth. She's experienced relatively good health, although she sustained and survived a few serious infections. One 66 years ago called dinosaur extinctitis. And 150 years ago, she began to develop a fever of unknown origin. The next 100 years, she's been plagued with increasing array of symptoms, with sweating, palpitations, respiratory difficulties, and abdominal discomfort. The last 40 years, these symptoms have progressively increased. And now, not only does she have states of hypothermia that are consistent, but she has worsening intermittent high fever spikes, edema, and excess flatulence, and other symptoms. Her vital signs, her labs and her exam today are very troubling, indicating multi-system dysfunction. She's a markedly elevated temperature, actually 116 degrees today. She has electrolyte imbalance, indicating dehydration and acidosis. She has a markedly elevated carbon dioxide levels, indications of multiple infections with a concern for septicemia, and dramatic alterations of her gut and skin microbiome. Her mental status exam reveals a mature, pleasant, lovely woman, but she is quite distressed and extremely depressed mood with suicidal ideation, which alternates with denial of her illness and manic-like symptoms. Despite repeated efforts to get her to make preventative efforts and manage her symptoms that underlie her problems, she's only been able to make minor, intermittent, and ineffective behavioral and life changes. She is very sick, and she's being admitted to the intensive care unit. You get the point. Our patient, Mother Earth, reflects the situation we all face. Human-caused climate change is threatening the health of our planet and all of its inhabitants. Continued dependence on fossil fuels have created greenhouse gases, resulting in the global warming which we're seeing and the huge intermittent heat waves we're all seeing. Efforts to address the underlying socioeconomic political causes have been fleeting and ineffective in curbing the rising greenhouse gas emissions. These health threats are urgent and extensive. They aggravate existing conditions and create new health problems. So what I want you to take from today is I want you to understand that this climate crisis is a health crisis and a mental health crisis. I want you to know that we are all at risk, but not equally so. And I want you to consider, and this is probably the most important thing, that there are things to do that will determine the future. But our house is on fire. I've been invited here today to discuss with you the mental health and psychiatric impacts of climate change. And I will do that, but in a rather cursory bird's eye view. You are not primarily mental health professionals, but come from a wide range of health disciplines. And you do not need to know today the deeper details about the mental health impacts, although I'm very willing to share that with those who are interested. But I want you to know, I want you to get it. I want it to become a part of you, that this is an emergency and that we must do something now. I just want to share with you this very proud history we've had at confronting prior health crises here at UCSF. And just want to remind you of the extraordinary leadership during the AIDS crisis that came out of UCSF. And I want to suggest to you that today, facing this climate crisis, we must apply our UCSF smarts and our commitment to this huge existential threat of climate change. So now I'm going to pivot to that discussion of mental health impacts of climate change. And for the purposes of this discussion, I've organized those in what I call these 4 buckets of climate psychiatry. But of course, we know that these are all interconnected and impact each other. So heat. Extreme heat events kill more Americans than any other weather event. And of course, any of us who are reading the newspaper daily are very aware of the huge heat that killed hundreds of people in the Pacific Northwest in June. And this is persisting. The mentally ill die at 3 times the rate of those without mental illness during extreme heat events. These deaths are preventable with outreach and intervention. But beyond just the issues of mortality and morbidity from heat events, there are very specific things that occur in the realm of behavior and mental well-being. We all feel kind of cranky and irritable during extreme weather events. But there is also a very significant increase in aggression and violence. from intensified road rage to kids on the baseball field getting into scrapes, but there are much more significant violence and aggressive issues, particularly when domestic disputes turn nasty, which has huge implications for child and women's abuse in the home. And also there are increased violent crimes, intergroup violence, and interpersonal violence that are of great concern. Suicide, which I consider a kind of aggression turned inward, also increases due to extreme heat alone. And of course, suicide is a multifactorial issue, but this is due to heat extremes alone. An important research paper, the author of which from Stanford has projected that there will be an increase of 21,000 suicides due to heat alone by 2050, if we do nothing about the escalating heats we're seeing now. That wipes out all gains in suicide prevention programs and gun control. Then beyond that, there are concerns about mood with extreme heat impacting depression and causing greater difficulties in hospitalizations due to that. Cognitive impairments and thinking is impaired, with working memory particularly, where there's a wide range then of increases in work site injuries, decreased learning, impaired judgment, affecting his executive functioning, which has huge implications for those who are marginally compensated, particularly the mentally ill and those with dementia during extreme heat, and being able to make decisions about their own care. Sleep is also impacted, and many of us have a hard time sleeping during heat waves. Well, sleep trouble impacts everything and adds to all of the other difficulties. But particularly it has an impact on the mentally ill and can aggravate mental illnesses and particularly trigger mania. And depression, medication impacts. The psychopharmacia that we use in my field have significant impacts on decreasing the body's ability to sustain and regulate our body temperature. And that's of concern as we think about how to treat our patients. And this is not solely limited to just psychiatric medications. I'm going to pivot to acute disasters. Wildfires are our Western disasters, and they take a horrific toll on individuals and communities, and especially a huge impact on children who rely on a sense of safety for their growth and development. But as you can see from this slide, extreme superstorms and flooding also are part of acute disasters, and we're seeing those now all over the world. Now, there is a whole body of understanding within disaster psychiatry that looks at the impacts of acute disasters, and they are organized around these particular domains of acute stress disorders, the added risk of behaviors during acute disasters and just following, and also the aggravation and intensification or the addition of new psychiatric syndromes from depression, anxiety, PTSD, and complex grief. Now, no acute disaster emerges de novo. There are always preconditions and things that contribute to the onset of those acute disasters. And I'm going to call those slow-moving disasters. So think about the situation that we're now in, where the severe drought that we're in is contributing to the profound, relentless, severe fires that we're seeing now. And this slide was made about those earlier years when we faced this. I'm wondering, Are you developing some compassion fatigue? Does this start to feel like Groundhog Day? We can't succumb to that kind of retreat. Now, slow-moving disasters, drought, sea level rise, air pollution, and the gradual degradation of our environment could all be a subject in and of itself. But these unique impacts I'm going to bundle together for our conversation today. These disasters have a wide range of mental health impacts. They can be acute or late onset, they can be intermittent, and they can be temporary or persistent. There's a loss of our social network during these disasters, which is troubling for communities and individuals. A loss of access to basic needs, housing, food, and water scarcity. We have a breakdown of the health delivery system, making it all the more difficult for healthcare providers to provide the needed acute services. There can be a potential breakdown of civil society structures, and there is this vicious cycle of the slow-moving disasters into acute events. But these slow and acute disasters are now cumulative, and they are leading us to a world where there is less habitable space to live in, and creating the circumstances for what I think may be the most severe issues facing us in the next 50 years or so, and that is climate refugees. The Intergovernmental Panel on Climate Change estimates that there may be a range of 200 million new climate refugees by 2050. That's one in every 45 people in the world, a tenfold increase over what we are seeing now. And I'm just going to follow this story of climate refugees, which is occurring all over the world. Droughts lead to crop failure and livestock losses, threatening food and water security. There are pressures for urban residents to move to crowded urban areas. These are mostly men who leave their rural homes and communities, leaving women, children, elderly, and those frail, ill, with little resources to support themselves and provide their own necessary livelihood. Families are disrupted. However, we are seeing more and more women and children into these forced migrations as refugees. And I'm very concerned about the risks to women for rape and possibly human trafficking that this represents. Now, many of these men move to these urban areas where jobs are scarce, and many of them lack the skills needed for urban jobs. This aggravates inner-city urban poverty and intensifies urban strife, and it threatens unstable political and governmental structures. And this is just a pictorial study showing what's happening on our own continent with Central American refugees attempting to come to our borders and being at times picked up by the border police, or those long lines at Customs and Border Protection as they try to enter. But this physical displacement, the climate refugees and migrants, threaten our own sense of security and evoke some fears in those host countries where refugees are attempting access. Fears and threat and sense of threat trigger some of the very primitive feelings and defense mechanisms and evoke, I think, some of our worst tendencies to see new migrants as not me, not us. What we in psychology call creating the sense of the other and seeing the others as the projection of all things bad. that the other embodies what we think are bad, and then seeing them as not human. This is fueling the racism that we are so immersed in huge ways now. I'm going to pivot to the last issue of what are increasingly attention to this burdening new field of eco-psychology. These are emotional responses associated with perceptions about climate change and experienced by people who have not actually directly experienced climate disasters. They're considered the constellation of mental health impacts associated with the environmental damage and change, or associated with the uncertainty about the future environment and potential social collapse. This is not an official diagnosis or an official technical term. We don't know the prevalence, although we do know that more and more people are very anxious and concerned about anthropomorphic climate change. There is much written in the popular press about this, but I will tell you, it is the #1 issue that journalists come to us in Climate Psychiatry Alliance to comment on, and there is more and more professional literature. It encompasses a wide range of feelings that I would call under the umbrella of eco-anxiety. But I want to make sure you know this is not pathological. We should feel distress when faced with real threats that are wide range. In fact, anxiety can serve as an adaptive function, awakening us and signaling us to a real threat, motivating us to prepare appropriately and respond and find solutions. The difficulty is when these feelings become so enormous, so unregulated, and cannot be tolerated that they intrude and impair effective functioning. The challenge is to translate the distress into effective, sustained action to address the real threats. Anxiety in the service of action. So I will not apologize if I've stirred up some discomfort in you today, and I hope that we can manage that discomfort when I come back and address some of the solutions. But I'm going to turn this over now to my colleague and friend, Lisa Fortuna, who will talk about who is most effective, and then return later.
Okay, so I'm going to share. Okay, so thank you, Robin. So as she mentioned, I'm going to talk a little bit about focusing in around vulnerable populations. And I'll talk also a little bit about considering policy and practices that we might be able to engage in terms of responding to inequity. So some key points that I hope we can take away in the few minutes that I have is that we know climate change will alter Earth's climate and in many ways threaten psychological well-being. Today's children and future generations will bear a disproportionate share of the burden of that climate change into the future. And children and adults living in poverty in the US face amongst the greatest risks and impact. And we want to leave you, of course, with this idea that institutions of higher education like UCSF have a very important role to play in addressing climate change, the consequences, and in working with the community to address these. So again, children living today will confront even greater health risks. These are both medical and psychological mental health risks over their lifetime, with some studies showing that indicating a 30 to 100% increase in prevalence of selected health risks, including, again, medical and mental health risks by 2050. And this is in part because of developing organ systems, dependence on caregivers, that children, these are, characteristics of children more likely to be affected by heat stress because of their developing organ system and their physiology. Natural disasters and air pollution also higher impact. And then family stresses like linked to the droughts that we've been talking about, dislocation and worsening poverty that will all impact children. And women and the elderly and people with previous psychiatric illnesses, again, and especially people living in poverty, or homeless individuals, or with limited social networks, will also have, will all have psychological and physiological vulnerability. Profound changes in the environment and altered lifestyles is part of that. We talked a little bit already about environmentally motivated migration and climate refugees, and I'm going to talk a little bit in a minute about Puerto Rico and my experiences with Puerto Rico. Economic and social difficulty increases the incidence of mental illness. And we know that that's going to affect certain populations in particular. This is a graphic that I tend to show from Barry and et al. They came out in 2010, but very much relevant currently and in the present. That really climate change obviously has an interaction with disasters and acute events. And you can have acute events as well as chronic events. And these all have impact on cultural, economic, social, developmental, and environmental context. So if we just look at this graph a little bit, if we have climate change related disasters, obviously it creates damage to landscape and agriculture, and that has direct impact on communities. There are economic, social, demographic impacts, and particularly much so for people with already experiencing inequities. This only leads to further loss of livelihood, poverty, isolation, alienation, grief, bereavement, displacement, and that all of those have an impact on mental health, both acute and chronic. And all of these issues around economic, social, and demographic impacts also have an effect on physical health. And that we know that there's a reciprocal relationship between physical health and mental health. It is like what Dr. Cooper said, mental health and all of those things are the same. The other thing about related disasters is that it causes direct impacts like burning and heat, and indirect impact obviously on then food supply, which also impacts physical health. So the environment is affected, physical health and mental health is affected. And then there's a direct trauma and solastalgia, as was also mentioned, that has a direct impact on mental health. So all of these things are interrelated and are really vary based on the cultural, economic, social, developmental, and environmental context of communities. And so even if we consider our pandemic, our current pandemic and syndemic, which is the interaction with the racial violence and racial injustice that we've been seeing, intersecting with climate change, really these things are all interrelated and interconnected issues. And so what the literature is saying more, and what we're experiencing, I think, in even our circumstance with the pandemic, is that what's needed is really, sustainable development of resources that support people who are experiencing a lack of resources and social determinants of health and mental health. And that we really need to think about environmental justice as part of climate change. What are the disproportionate impacts of these crises on certain communities, and what are sort of policy and practice decisions that we all have to make around making things just for disproportionately impacted communities. And also that we need to really engage a lot more in community-led climate adaptation and working with communities to address these solutions and needs. We talked a little bit about this in the fact that young people are anxious, and this is a little bit of a dated study, but I think we see even more right now during the pandemic, where 10 to 12-year-olds in the U.S. had really strong feelings of sadness and fear and anger about climate change and environmental problems. Up to 82% of children expressed this in this one study of 10 to 12-year-olds. And also many young people believe that the world may end during their lifetime. And again, likely worse now with all of the things that we're encountering. And one of the things I wanted to highlight too is considering the impact of climate change on students in higher education. We often think about school age children and the impact, but it also has an impact on higher education students. We know higher education is a pathway for upward mobility for minoritized populations. Income and education are interrelated. They're the two social determinants of health that are definitely linked with health outcomes and mental health outcomes for communities. And really the role of higher education is to reduce, we need to reduce health disparities and improve population health. And there is a role in there of also addressing climate change. Again, if we're thinking about climate change having disproportionate impact on certain populations, then we need to also think about how climate change may impact communities of students that we serve and teach and our learners who might be disproportionately impacted. And we know that that did happen to some degree with the pandemic, where individuals who, who had a lot of loss in their families and financial losses, had an impact on their ability to continue in education. And we saw that, and a disproportionate amount of stress as well. And we saw this in Puerto Rico, where, after a climate change related event, which was Hurricane Maria in 2017, there was a tremendous amount of stress and displacement for Puerto Rican students in higher education. They had to consider multiple things like staying and helping family while waiting for the university to open up again, which took many, many months. Delay in education, which had funding implications like loss of scholarships and financial aid. And some had to leave temporarily to the mainland to continue their education. And some had complete disruption of their education, including not completing their dissertations. So, so obviously where communities are impacted, there is an impact for higher education directly. And this is just some things from a study that we did in Puerto Rico, where students in college and graduate school talked about, the extreme stresses that they experience, including loss of essential needs and resources, uncertainty, having to find social support, and, having difficulties with the educational disturbance. So this was just one study that we looked at. And then there is also the migration or the uh, uh, refugees of climate disaster events that has also been mentioned, and this just describes this for Puerto Rico, where there was already a post-economic crisis migration because of the economic stressors, and then with Maria, you see the yellow area of sort of just an escalating amount of back and forth migration, but definitely much more of an exodus from the island. Brain drain that resulted displacement, disconnected families, all of that. So, and then we also saw that in Puerto Rico, the effects on young children really are, there's a significant proportion, more than half of the children on the island live below the federal poverty level. And early childhood is a critical period of development. And so we know that, children living in poverty will quickly fall behind their more economically advantaged peers if they, on top of that, have these added stressors and displacement and educational limitations as well, because school age, elementary schools were closed for a very long time as well. And so this has a direct impact on physical, cognitive, and emotional development long term. And then in our own local area, if we sort of bring this home, right, is that, we have the risk of sea level rise with increasing changes in our environment. And that poses a real threat to people living in the San Francisco area and the Bay Area. It has issues for our structures like utility and power plants and human and natural systems, disruption of essential services. All of these things, are very significant, but they also have a significance for, essential workers, people who are on the front line, and communities who are living in those areas that might have increased flooding. And for the Bayview Hunters Point, something that is already on people's minds is that, that area has already suffered from health problems due to air, water, and land pollution. And if the sea level rises and contaminated areas are flooded, that's going to have further exposure and dangerousness to that community, and very dire consequences, long-term consequences for children. And obviously, this also impacts mental health, especially when one is experiencing multiple disparities and oppression, which become cumulative. So the way that we can respond, I hope, to the impacts of climate change and crisis is really to work. I would really encourage us to build relationships with schools and communities to engage communities and children. Building what we know is building the agency and engagement of children and youth builds resiliency. It builds, a sense of efficacy and capacity to do something about what's happening around them. And we know that kids are hungry for these things. There's an upsurge, and has been so continuously in school strikes for climate action, as well as racial justice. And so they're primed to really look at and grapple with these very difficult issues. And just to underline, Dr. Cooper was saying, that ecological worry, habitual ecological worrying about what's going on is not a pathological worry. And that actually, what this one study found is that habitual ecological worry is really associated with pro-environmental attitudes, imagination, and appreciation of new ideas of how to create solutions. Um, and this is sort of just a picture from me in Puerto Rico, talking to some school-age children who, I was talking to them about sort of their concerns about the hurricane, but also the environmental and climate change issues. And they came up with a mantra about, soy flexible, I'm flexible, I'm strong, and I have deep roots that interconnect with the roots of others. And there was a lot of dialogue around the importance of community engagement and connections to be able to address both the immediate stressors and horrors of the disaster, but also to come together around solutions around these environmental changes around them. And so this is just to really point out that we really have to engage children. We often seldom tap really the potential that they really have to work with us in addressing educational and sort of strategies around addressing the problems that we're facing. And there's actually research also on how we can best do this. And one of the things that some important themes about how higher education can involve youth on topics of climate change is really initiating deliberative discussions that we can have with kids in schools, facilitating interactions with scientists, right, which we have abundance of, and addressing misconceptions, and then working together on implementing school or community projects. And those all can impact direct solutions, but also mental health. And so, we all know these major things that we can do, really divesting from fossil fuel related industries, renewable energy, phase withdrawal of existing investments in fossil fuel, and also some universities are generating their own renewable power. And so, working towards that zero carbon emissions, and then also, but also integrating climate change impact in the messaging around how it impacts on mental health, and vulnerable populations, the things that we are talking about today in our curriculum. There can be community partnerships and advocacy in addressing inequities and climate change vulnerabilities, similar to what, some of the things that you saw in youth and communities in Puerto Rico. And readiness for responding to student and faculty needs in higher education, and the community needs related to climate change related events, like what will we do with increasing fires and flooding, and partner educationally with community initiatives. So I think those are sort of my comments to start, and I will stop sharing and hand it back to Dr. Cooper.
Thank you very much. Let me just get this back up and move. Thank you, Lisa, for underscoring the social determinants, the impact of kids, how it all connects with diversity and equity, which we know is such an important value here. I'm going to bring us to the discussion of solutions and hope that we can have a discussion about that here at UCSF. Lisa's already set the stage for some of that by bringing up in her last several slides some of those policy opportunities. I want to just outline that solutions happen at many, many levels, at the direct patient management or at our individual personal level, at the institutional and community level. And Lisa has highlighted how important it is to create those community collaborations. And then, of course, policy solutions. But I want to share with you this infographic, a tool to be used for patient education in surviving heat waves. This is a collaborative project that Lisa and I have worked on, which has been funded by the generous support of the Earth Center in creating this infographic. And I want to just give a shout out to Anne Marie Charlesworth, who I think is is here with us today, for supporting this project. This is an infographic that can be used, downloaded, but Lisa and I already have some printed versions of this. And what we're pleased about in regards to this educational material for patients is that the most important thing is that there's translation of these into Spanish and Chinese, because we know how incredibly important linguistically available material is for our patient population, and it's a part of addressing some of the disparities. As I say, this is downloadable, but we also have print versions. But our hope is to get this in as many clinics as possible, and wonder what you can do here to help us get that into the primary care clinics at UCSF. So I'm going to switch and talk a little bit about the Academic Senate and what you are all involved in and what you've done already. The Academic Senate has already worked to create the Office of Sustainability under the extraordinary leadership of Gail Lee. And this oversees the actual sustainability and operations side of how the campus functions. You've already voted to join the successful UC system-wide effort at divestment. And Lisa has also commented about how important some of those divestment efforts are. And most recently, the Center on Climate Health and Equity, which aligns the issues of climate health with the commitment to diversity, equity, and inclusion here on campus. It has been created and is now co-led by climate heroes, Adrian Ann Taharini and Sherry Weiser as primary leads, but many other climate heroes here. And this builds on the Sustainability Office's focus on operations and brings into the issue into the academic realms. And also the academic, you have just created the newly established Academic Senate Committee on Sustainability, moving this from just a advisory status to a permanent committee, which will address the educational, academic, and clinical issues on campus. Now, these two new established structures have just begun their work. They're in their formative stages, and it's not yet clear which will take on and contribute in what domains. However, it is clear that the essential issues that will be addressed are the profound effects of physical and mental health from climate change, the overwhelming contributions of the health delivery system to carbon emissions, and how to develop here within our own institutions the ability to sustain the delivery of care during the inevitable climate events, how to build resiliency and be able to provide the health care when we are threatened by climate issues. One of the other exciting ideas that is percolating is the creation of a fellowship on climate change and health. There are only two that exist in the country now, Yale and the University of Colorado. Now UCSF has the faculty man and woman power to make major contributions if such a fellowship would be formed. So stay tuned. We can take a leadership role here. There is so much to do. And what is the role of the academic senate in moving this forward beyond what you've already done? We know that our faculty are concerned and want to be involved. And we definitely know that our students are seeking, they're clamoring for ways to make a difference on climate change, both from an educational perspective, but involving themselves in projects and research. But there are profound obstacles to faculty engagement. Now, I, looking from the outside, can only identify some of those. Time, money, and profession and academic advancement are some. And I just want to hone in briefly on the issues of academic advancement, since I wonder if there are things that you can do in the academic to facilitate this. How you can help to include the range of climate activities that faculty are involved in the promotion packages, that the work that they are doing is encouraged and rewarded. So there is so much to do, but you do not have to do this de novo. There is an array of army of volunteers already involved. Climate leaders here at UCSF who are engaged in shaping the direction. And I just want to mention Katherine Gundling. She's another climate hero, and she knows what is going on in many arenas. And she can kind of be a traffic cop. She's on the new committee that was just formed, and she can give directions for some of the ideas. But I want to leave, what are your thoughts? What ways can we engage with this? And then I think we can open up and share some conversations.
Thank you, Dr. Cooper and Dr. Fortuna. So we have about 10, 11 minutes left, and we'd like to take the remaining few minutes of our sessions to give Dr. Cooper and Dr. Fortuna an opportunity to address any questions that the audience might have, and to give the audience a chance to contribute with any comments and ideas for ways to become involved and to really take advantage of the policy practices that were mentioned, as well as kind of take advantage of the established structures within the institution to really get involved and make actionable change. So if there's a specific question that you'd like to bring up or a comment, you can feel free to raise your hand, and we will go ahead and let you into kind of the panel discussion.
I did see a question that I answered in part in the QA piece.
Yeah, I'll go ahead and summarize the question, and then Dr. Fortuna, I'll give you a chance to address it. Does that sound great?
Great.
Okay. So this is a question from one of the audience members requesting the panelists' thoughts on children, increasing number of children that are now being seen that are more experiencing suicidal ideation, based on the lockdown, and kind of expressing a few concerning beliefs, including one that the world is going to end soon. And so, what is the point of remaining alive? Two, that humans are hurting the environment and therefore, we or I should not be alive. And three, that currently the state of the world is so bad that what is the point of kind of following the rules of society, And so why do I care about not fighting or not stealing or not attending school if, the future is looking so bleak for the environment? And a comment made after the question was posed by the same participant was that perhaps an intervention that seems to help show the children that in other places children are happy and helpful may be a way to start addressing these thoughts, that these bleak thoughts that children are having and are becoming more commonplace. And I'll pass it over to you, Dr. Fortuna.
Yeah, I mean, I had commented a little bit that, I think we're in such a tough spot, right, in terms of the pandemic and this climate change, sort of that whole cumulative interaction that I'm talking about, where kids, the world's very different and strange, and it's really an impact on kids. I think reconnecting kids to the possibilities is important. What I was mentioning around education, and I think UCSF can be part of this, is, how can we educate schools and communities about what can be done, right, in terms of climate change? What can we do now? This idea that humans have hurt the earth. Well, humans can be part of healing the earth, and that they are very important to that. And we have to show them that we're doing it too, right? Because they have the energy and desire to do something as a group, right? As young people. Some of them are feeling hopeless. And I put there, it's like Mr. Rogers said, when you have a crisis or a shooting, show them where the helpers are, right? And I think UCSF can be those helpers, that we're doing something, right? And that then the children are also really important about doing something. And in Puerto Rico, I just show you one project that they did is they started to create hurricane resistant farming, and kids were involved in that, so that if there was a hurricane, there would be a sustainable farm in their community where people could actually eat. But one of the things that also it helped is help them reground themselves in the earth, and that we actually are part of working the earth, healing the earth, nurturing the earth. Kids need to be reconnected to that, right? And so we can do that through projects, through advocacy, through science, that they have agency around that. But I think we have to, I want to push us to sort of be visible helpers, so that they don't feel like they're alone. Those are some ways, from a public health messaging perspective, I think we can help that.
I just want to add to Lisa's comments, giving kids development, helping kids develop age-appropriate ways to get them involved. And kids learn differently across the developmental spectrum. And I'm just going to share, I hope maybe you can see this. I'm not sure if it's visible, but this is a children's picture book written, it's called Fur and Feathers Stand Together. And I guess the reason I thought about it, it's a children's book about the furry creatures and the birds coming together and organizing and have an impact on the world that is being damaged. And I think it speaks to using appropriate language for children, but also the message of how do we help them find real ways to engage in solutions. Like Lisa said, connecting with nature, older kids, creating educational forums and being involved in community gardens, things that bring out a connection with making a difference, I think is really important to offset the profound despair that many of our kids are experiencing.
Thank you. Is there anyone else in the audience? We have a few more minutes who would like to make any comments or pose any questions. Let me see. I think we have something in the Q&A. Okay, so someone just posted a question. So there's a course in place for high school students, and it's called the Earth System, which speaks to what the panelists were discussing. How would you bring the urgency that you are speaking of to the classroom and to their homes, for them to speak with the sense of urgency that we'd like to communicate?
I would let Dr. Cooper add in too, but I mean, I think this outreach and educational piece that I'm thinking, that I was sort of mentioning in my presentation, like I think this is really prime for a real sort of public health messaging, right, around the urgency of this, but also sort of balanced with well-being and community engagement and solutions, right? Again, it's not sort of alarmist, but inspiring and let's move, right? But then that there actually are things that we can do. And like right now, I'm working on a mental health campaign that's looking at racial trauma and the pandemic. And I'm actually more and more thinking about how we need to integrate some of these messages about these multiple issues that we're facing, and the urgency of all of those things working together and the interconnection of those things. But I think it requires an active public messaging. I don't know, Robin, I don't know if you wanted to add.
I couldn't agree more. I just want to underscore though, the youth have also lit a fire under grown-ups.
Yeah.
Look what's happening with the Sunrise Movement. And so channeling those despaired feelings into a sense of outrage and mobilizing anger to be effective and saying, we got to do something. And I think kids, just like adults, have to come together with their peers and our communities to actually create some of the efforts that all come together in having an impact here.
Mm-hmm. And also, again, listening to those communities that are disproportionately impacted, because I know that there have been sort of environmental justice and racial justice and, sort of movements around toxicities and other things that are in their environment that, we need to bring to partner in those messaging and to hear that.
Great, fantastic. I think there's anyone else with a question for Dr. Cooper or Dr. Fortuna? Got about a minute left, or any comments?
Last one question. This is Katie Brooks coming back in before we close. There's been a rise in discussion about adverse childhood events in the last 10 years and measuring those and their impact on adult health. I'm wondering if you know of any studies that have tried to incorporate the impact of disaster, climate disasters or other impacts of climate change on health later in life, and that's sort of the trauma impact of that, or whether anyone's looking at that.
Yeah, so I actually started a study that was on anxiety, and it included the ACEs as part of the questionnaire. And we're still engaging in that study in Boston, but we added something around disaster or climate change events impact, and sort of so we'll look at that soon enough. And in Puerto Rico, I could sort of send forward there were multiple studies looking at the impact of the climate change and the disaster on child and other populations, and even pregnant women and dyadic sort of mental health after the disaster. So I can send resources about that.
And I do believe that there may be some efforts in the pediatric organizations to add climate into the ACE material.
Right?
Thank you very much. That's helpful.
Okay, wonderful. Dr. Cooper, Dr. Fortuna, thank you so much for sharing your time with us, your expertise. This was a wonderful joint talk, and we really, really appreciate you coming and spending the hour with us. And if nobody has any more questions, I think we'll wrap up there. All right. Okay. Thank you very much, everyone. Thank you for everyone for attending. And again, Dr. Fortuna and Dr. Cooper, we really appreciate you coming and sharing your time with us.
Thank you.
Thank you again.